Hello. Hi, thank you for having me. So I'm Amy, and I've come to talk to you about SWAN UK and show a little bit about my son, Freddie, who's my oldest of three, and how he's undiagnosed. And my friend and I, Clay, thought it might be a good idea to film me doing it, so that for anyone that couldn't attend today, we could share that via a clip on email for anybody that wanted to know a bit more about it. It's an invaluable resource, really, for parents in my situation. And I also provide a mentoring service for other parents of children with special needs, so it would be something to share with them, perhaps via SWAN UK. So as long as everybody's okay with that, that would be really helpful. Okay. So SWAN UK is a fantastic initiative, and it is run by a charity called Genetic Alliance UK, who also have Rare Disease UK. So anything to do with genetics, genomics, all of those things that are slightly over my head, that's what they deal with. But SWAN UK in particular is the only dedicated support network for families who have children really from 0 to 25 without a diagnosis, to explain their difficulties and their disabilities. So I thought if I just took a few minutes to tell you a little bit about Freddie, who's my oldest, and us, just to give you a bit more of a picture about what it means to be undiagnosed, and then I'll tell you a little bit more about SWAN and perhaps how they could help some of the patients that you work with. So I live in Warwickshire with my husband Ollie, and we have 3 children. So Freddie, who's our SWAN, who's coming up to 6, Bella, who's 4, going on 14, Jago, who's almost 2, and we have a dog, so it's rather busy in my household, but that's good. So actually I'll show you a picture. I grabbed this off my side, it's a bit far behind, but this is Freddie up here with the little one and Bella, so it's a bit manic in our house. So Freddie's neurodevelopmental problems were first picked up at my 20-week scan, so just going for regular scans, and it's your first baby. So that was quite hard, and I'd actually lost my father a year before that to cancer, so we were kind of hoping for this wonderful pregnancy and a new life coming into the family, and we were really hit with a bit of a bombshell. We didn't really know what was going to happen. So we attended some scans really from that point about every other week at Birmingham Women's Hospital, and we had amniocentesis, which was fairly horrific, microarrays, blood tests, you name it, we had it, and they couldn't tell us what was wrong and really why his brain was developing differently to that of a typical child. So it turns out from all of the scans that we had, including MRIs, which is, I can say, is very difficult when you're heavily pregnant to lie on your back for that amount of time, but we had 2 of them. And that showed us, we have a whole list, so I will have to read them. Freddie's got enlarged ventricles, microcephaly, a small cerebellum, reduced white matter, reduced sulcine gyration of his brain, a thin corpus callosum. He also had heart and liver problems, but they actually did rectify themselves before he was born. He also had, possibly believed to be in the 2nd trimester, an ischemic insult to his brain. They don't know why, they don't know if there's a connection to it or not. And he's now, in the last 6 months, started having some sort of forms of absent seizures, which we're kind of watching at the moment. So he's quite a complicated character, and I would say that really at that point, my husband and I were pretty emotional at the time, emotional wrecks really, and there wasn't a lot of support. The main thing that we had was a visit to see a neurologist, a paediatric neurologist at BCH, Birmingham Children's Hospital. And we looked at the MRI results, and I guess we were hoping for some answers. And I'd done the Dr. Google, and I'd been through and looked at everything, and they really couldn't tell us what it was. All they could actually say was what it wasn't. So we still had no idea, other than just that there would be some developmental problems, but there was really no support out there. It was just a case of wait and see. And I think because it was so difficult for them to tell us what it could be, we did have some genetic counselling, although I didn't realise that's what it was at the time. But then they were saying to us that if we felt that it would be so difficult, that we could go to panel and have a termination up to 40 weeks. And Freddie was born spontaneously at 35. So when I think back at that and what he looked like when he came out, it's quite difficult to think about. Really the early days for us were quite a blur. We spent just 1 week actually, so we were quite lucky, but in special care. We did have a local paediatrician who we were discharged to, and our experience of that wasn't a particularly positive one, unfortunately. And we also had a number of health visitors, and they were working in a very busy service, but again, hadn't really taken the time to read the notes or to find out what was happening, so we were treated as any other parent with any typical child, which of course we weren't. But when he was about 9 months old, we moved area, and we came across a fantastic health visitor who really championed Freddie and really championed us and made a massive difference for us and helped us get into other services, even things that I'd never heard of, because why would I? Portage, speech and language therapy came along, all sorts of things. So that was a game changer for us. And then in the summer of 2013, my mum called, and she, like I, did lots of Googling and trying to find out if there was another Freddie out there, putting the signs in, the symptoms, coming up with nothing. But she said that she had been online and found an initiative or a charity called SWAN UK and thought that I should give them a call. And I did, and I'm so glad that I did. I actually just wish that I had known about them at the beginning. And that's part of the reason why we share this information now, because if somebody had been able to give me a leaflet or just tell me about the website address, it might have taken me a while to come round to it, but I would have known there was support there for somebody in our situation where actually there is no diagnosis for your child's difficulties. Freddie's delayed in all areas, in actual fact, so you often get the letter, the child's got global developmental delay, this and this. And I think in the beginning, until you realise that that's not a diagnosis, you think you've got the answer on the piece of paper, but obviously, as you know, you haven't. So he's delayed in every area. He's also got low muscle tone, speech and communication difficulties, including verbal dyspraxia, which we've recently had verified. And he also has hyperplastic optic disc, so the nerves in the back of the eye. And he's such a lovely, cheeky, funny little boy, and his language is emerging now, and he loves his brother and sister. He can be a bit of a challenge at times, but I think a lot of that behavioural is down to his challenges, obviously, and his frustration at not being able to be understood. In fact, we are now, or he is, I should say, a graduate SWAN. We were part of the DDD study, Deciphering Developmental Delay, and we do have a diagnosis, but it is so rare. There's only a handful of children known to have it in the UK, and it's called tuber 1A. So just one faulty gene in him went awry, and that's caused it. But the linking factor is the hyperplastic optic disc, and that's where they realised they had an answer for us. So we basically stay where we are as part of SWAN UK, hence why I'm doing this today. And it does sound a little bit dramatic, but actually finding SWAN UK really changed my life completely. I was very much alone before that. You feel very isolated. I think sometimes families with disabled children feel isolated anyway, but when you don't have a group to go to, you really haven't got a clue. So yeah, that really changed it for me. And because it made such an impact on my life, I decided that I would take on the voluntary role of parent representative for SWAN in my area. Wanted to get other families together to provide local support. But actually my biggest objective is to do things like this today and to meet with professionals such as yourselves who can actually change that path for parents like me, just by telling you a bit of information about it so that you've got it in mind. And if you meet families, or maybe you've got them on your caseload, maybe the child's 18, but actually they don't have a diagnosis, the support network could be really useful for that family, just to know there's someone else out there. So in a nutshell, that's us and where Freddie is. And so I think perhaps if I just tell you a few key things about being undiagnosed and a few key things about SWAN, and hopefully that will give you a sort of a round idea of it. So I don't know if you're aware, but the stat is that there are something like 6,000 children born in the UK alone every single year without a diagnosis to explain their difficulties. And 50% of those children being tested on the NHS won't receive a diagnosis. So you kind of go through it. We never expected to have a diagnosis, so we were kind of sort of one of the lucky ones, if you think of it that way. And I think there's about 30 to 50% of children with severe learning difficulties and congenital abnormalities who may never receive it, I think. One of the other challenges for us is that when you live with a child without a diagnosis, it's very difficult to gain support and to gain services, and sometimes you're not believed. And it's very difficult to explain why your child has this. You know, if you can say my child has cerebral palsy or they have Down syndrome or whatever a slightly more common diagnosis might be, there are things in place and you tick a box and it's very easy. So that's one of the challenges that SWAN UK take on board, is to help provide that joined up care and help support parents to find the care that they need. And because of that, it can really affect the parents quite a lot. with sort of low mood and worry and depression, anxiety. And I know at my worst point, before we found SWAN, I was having every single week very, very, very bad head pains. And I thought, well, it's not a migraine because I have those, and it's not a headache, and no analgesic would take it away. And I ended up at the neurologist's office because I actually thought I had something quite seriously wrong with me. But it turns out it was the stress, the stress level on my life. So I had to do something about that. But at least I knew what it was and could kind of take control of it. So I think, yeah, when you're meeting new families or anyone on your caseload already, obviously do think of that, because they might have been told they've got global developmental delay, and if that is the case, then SWAN UK could help support. If they've got medical, physical, learning difficulties, which are currently unexplained, again, we can help them. It might be that actually you think they've got a suspected genetic disorder, but perhaps it doesn't look like how they normally look, but they've got some traits and you think it could be, but so you're not really sure why, then perhaps there's a way we could help them with that. Maybe they're having microarrays and there's some sort of unknown clinical significance to the findings. Well, I know we had that, so it was just disregarded, but obviously there was something in there. Or maybe they're on the DDD, which has now closed, but the 100,000 Genome Project is still ongoing, so you might find that you've got young people or young adults on that coming to you. And if they're on that, again, we can be of support to them. And so there are many, many, many families like mine out there. We just don't know where everybody is necessarily, because they don't always know that they can speak up and find someone. So our target as SWAN UK for 2017 is actually to double our membership, to help double the number of people that we are helping and supporting. And a number of the ways that we do that, each year we have an awareness day. I know lots of charities do, but we do have that. We're in the month on the run up now, so it's on the 28th of April, on the Friday. Undiagnosed Children's Day, where we'll be raising awareness and talking to lots of people about what we do as a charity. But the key elements for SWAN are that we have a 24/7 access to support, mainly online through a secret Facebook group, so you can ask everything and anything. You can say whatever you like, and there would always be somebody there to help, and that's very useful obviously when you're also in hospital, not just when you're at home, because you could be quite cut off in hospital. We run regular events, so last year I did one for the Cotswold Wildlife Park. We had everyone there with pink balloons, and it's a lovely opportunity for families that sometimes don't get out to be able to join together. And also for siblings. I think for siblings, when they sort of realise they have a brother or sister who's disabled, but they don't really know what it is, how do they communicate that to others? So there's a way for them to make connections with other siblings in their situation. And obviously we also do things like this, and talking with people who are in the know and who can help others. I recently did a talk for paediatricians at Warwick Hospital also, under the same vein, so that hopefully everybody's starting to know who we are. And in fact, because we have such a difficulty being undiagnosed in gaining the services that we need and making them joined up, we actually now have at Great Ormond Street a dedicated undiagnosed nurse, and she is funded by the Roald Dahl's Marvellous Children's Charity. Because of that reason. So some children, we're quite lucky with Freddie in that he's not particularly medically complex, but there are children who do have so many things and there's no real connection, so she helps facilitate that for the parents to try and ease that journey for them. So really that is SWAN and what we do, and hopefully everyone's got one, a leaflet about it. And if you want to have any more leaflets or any further information, obviously it's the website you could guide people to, or make contact with the number and we can send more out to you if it's useful and beneficial. And if you know of anywhere else that I might be able to go and talk and tell people about SWAN, perhaps let Dalipa know if you wouldn't mind being the conduit between us. I'm always very keen to find other people that would be interested, that might be able to help us spread the word, just to support families like mine really. Are there any questions at all about SWAN or anything that we've said?
Are you able to help families fill in things like the forms for personal independence payments, that kind of thing?
Me, not personally. We do have lots of leaflets and information that we can provide with that, and we can also signpost it out to people that do that. So it's sort of like an advocacy thing, really, isn't it, to help people if they need it. So we wouldn't specifically do that, but we could certainly, if they come under the undiagnosed category, then we can help point them in the right direction. And also the other thing is that all of the members, I think we've got about 2,500 members in total, and let's say on the secret Facebook group there's about 1,300, so not everybody uses that facility, which is why we have other methods of getting information out. But there are a lot of people that have been through a lot of experiences. So you could literally ask any question and I can guarantee somebody has the answer. So if it's something like that can also be very useful, particularly when it comes down to how do I explain my child's difficulties without a diagnosis to receive the PIP or the DLA or whatever it is, because that can be tricky for us.
So yeah, that's outrageous that you've got somebody who's severely medically compromised, can't walk, they can't talk, obviously, just because they don't have a diagnosis, they cannot access services.
It's a little bit like computer says no. So if you can't tick the box, it's very difficult. You have to be able to have a very good relationship with the professionals that you're working with for your child, and that takes practice for a parent because you're quite emotional with things. You don't always get the gel of relationship, but I think if you can foster that relationship, and I've worked very hard to do that with the professionals that help us with Freddie, and we do have very good relationships now. They help support, and then once they understand your child, they can help champion. But everybody I know is very busy, and you've got a lot on the caseload, and paediatricians see children, 20, 30 a day, and it's trying to get all of those. So it's very easy to say you've got a diagnosis tick and this is what you need. But when you haven't, and sometimes you can't really explain why they do it or what the symptom is, that makes it a real challenge. So we have lots of people in our community who are turned down for DLA, but actually they're totally entitled to it, or turned down for a blue badge, but actually their child can't walk, or whatever it might be. So it is slightly more complicated for us, but often it's about saying it in the right way and getting the right advice to be able to get the information across correctly. But yes, I agree.
Did you find you had to push quite hard to get your diagnosis in your case? Did you say it didn't come around with the NHS?
I have to be honest, I was quite naive in the beginning. I don't think I ever really realised that it could be genetic, if I'm honest. I think because we'd had all the testing and they said we didn't know, I just sort of was in such a like this that I thought, well, they just don't know. And we decided to have another baby, and we went for a genetic appointment. I can't even remember who set it up. I think it was probably the paediatrician. And they said, oh, does your daughter have any difficulties? And I thought, oh, no, I don't know. And so it didn't occur to me. As it is, Freddie's genetic change is de novo, so it wouldn't have, but obviously I didn't know that at the time. So actually our ride has been fairly smooth in that respect. And as I said, I didn't really have any expectations for finding an answer, but I'm glad that we did, because actually the biggest thing for me was it my fault? Was it something that I did? Even though I was a bit of a goody two-shoes and didn't eat the raw steak and I didn't drink and I didn't smoke and everything else, but you just can't ever be 100% sure, and that is a massive factor, is the guilt factor. So that has taken that away for me, but it doesn't change what it is for Freddie, because actually on the study there's nobody above the age of 8, so we still have no prognosis for him. It's still as it is. So I like to assume that he can achieve everything, and we're just going from that starting point, but we have to wait and see. But yes, for some people it's a real challenge, and also if they have 2 children with the same thing. So I do have a friend who has 3 children, 1 neurotypical, 2 that are SWANs, and the one son died, and the other daughter is looking like she's going the same way, but they still don't know what it is or why it is. That's very difficult. And it causes lots of problems for families who want to have more children, who wonder if they should do, because they don't know the answer, or whether it's genetic or hereditary. So yeah.
You've raised the point about signposting parents who have a child with these multiple disabilities, not without a diagnosis. You've said that your current batch of professionals and the health visitor before is really good advocacy.
Yeah.
Are there any take-home messages that that 1 or 2 points that you really want us to remember, and how can we best help you or somebody in your shoes as a parent of a child with SWAN?
That's a good one. Definitely really, really listen, because I think, not that you wouldn't, but it's very easy, isn't it, to have sort of your medical hat on. But actually, for anyone who's a parent who has a child, one thing that I always say to other parents is that you are actually your child's expert. We're not medical professionals, and we don't know all about genomics, and we don't know about all the different medical terms, but I am Freddie's expert, absolutely. I am with him day in, day out, and if I see something that I think is of concern and I bring it up, it's to really truly listen to that parent and take note of them. I think I do some mentoring work on another side of things with families, and one of the things that often comes up is that, although actually it's never very often with GPs, in fairness, it's really when they're talking in other areas, perhaps in the hospitals, that they feel that they are subordinate and that they're not listened to, and that maybe because there is no diagnosis, actually they're kind of making it up a little bit. So that's really, really key, because sometimes those things then are missed, and that has an impact on the child. And really, the one thing that every parent wants is for a professional who has the correct insight and the speciality in that area to champion their child. It's never going to be the way that you champion your own child, but if you've got that support and that backup, that makes all the difference, and it makes that ride so much easier. Because every day is really hard, actually. It is really hard. There are lots of brilliant bits to it, of course, like with any child, but it is a daily struggle for anyone with a disability, I think. So having that backup and that listening ear is really key. And also not being afraid to ask questions, I think. Thank you. Anybody else?
You've mentioned a couple of studies.
Mm-hmm.
Do you mind sort of just briefly,
So the DDD study was deciphering developmental delay, and there are still numbers to come out of that. I think it's the end of this year. They probably will have given out all of the research that they can, all of the results. Some people won't have a result from it, and that's just the way it is. But we did have ours from that, but it is close to new members now. So the next thing that's running, and I'm sure they take adults as well, because the DDD was just for children. So I'm hoping that there will be some adults found with tubal so that we can see what the prognosis might be for Freddie. And that's the 100,000 Genome Project. So that's the one that if you wanted to suggest anybody needs to go on, or if you hear that anybody's on it, then that would be the one to send our way for assistance. And also on the website there is information about that, and on Genetic Alliance UK there's information about that side of things too. Okay, thank you very much everybody for your time. I do very much appreciate it.
This is a Ryan Little production.